Hello everyone, my name is Hamid. I'm here today to bring you a lecture about double slot bracket, a new concept of biomechanics, and I really hope that you enjoy this lecture. First of all, let me introduce myself. My name is Hamid. I'm a specialist in orthodontics. I'm also co-author of this double slot bracket. I'm the co-author of the double slot book called Innovative Concepts in Orthodontics, and I'm professor of postgraduate in orthodontics here in Brazil. Before I talk about the double slot bracket, let me show you a little bit of history. In all the history during our specialty, we have everything in our hands to do the best mechanic ever to our patients and for us. So we start from the first angle edgewise bracket to the aligners, and we move towards all history, and with every kind of device that we use, we may achieve everything that we need if you know how to use. And as well, every little device that is here have their own advantages and their own disadvantages, since the first bracket to the aligners. So what I want to show you today, it's about this bracket and a new concept of orthodontics. What you're seeing here is the double slot conventional bracket, and you see that it's quite different of every single device that we have nowadays, because this bracket here has two slots on the center of the device. The two slots are open, and more important, they are rectangular with different dimensions. Here is the side view of this bracket, and you see that this bracket, it's a bidimensional bracket. And why we call the double slot bracket as a bidimensional bracket? Because he has two slots and each slot has different dimensions. So what I'm talking about is that we have here on the gingival or the cervical position, the slot is an 18-inch slot, and in under it, or on the occlusal or incisal position of the bracket, we have a 22-inch slot. So you have something that never exists till now. And the most important thing here, it's not only about the use of two wires, just two wires, but I think the secret word and the secret to, I say to you, that is a new concept of orthodontic biomechanics, it's because we are working with two parallel wires. And this is, I think, the most valuable thing that we have, and we are going to show you today. And I just brought here my top 6 moments about how and why we have to use the double slot bracket in our therapy. Let's start for the number 1 of the top 6. Why I really believe that using the double slot bracket during my alignment and leveling, it's a little bit better than rather by using a single slot bracket. Well, first, if you are using the double slot bracket in the first stage on your treatment and you love to work with an 18-inch slot, you can work with the gingival slot, because he is an 18-inch slot. So you can work just like a one wire during your whole treatment by using only the 18 slot by choosing the gingival slot. But if you are the ones of the orthodontist that really loves to work with the 22-inch slot, you just move your wire till the occlusal or the incisal slot, and then you are working with a 22-inch slot. So you can choose whatever you want or need during your phase number 1 of alignment and leveling of the slot that you really love to use, because it's at your disposal, the using of the two slots. But nowadays, I just change a little bit my treatment therapy during this first stage of orthodontics. I really love to work with two wires at the same time. And why? I just believe that this bracket can bring you a little bit more advantage comparing to a single slot bracket. And here is one single example. Here we have a premolar that is rotated to the distal area. And by using a single slot bracket and one wire, what happened is that you create just one point of rotation on the distal side and on the mesial side. But if you are using this bracket here, the double slot bracket, along with two parallel wires, you double the control and the moment of rotation, because now you don't have just one point of rotation on each side, you have two on each side. So you have 2 points of rotation on the distal area, and you have another 2 points of rotation on the mesial part of the bracket, and this gives you a little bit more control of rotation. And this same thing is valid to tipping movement as well. So what you're seeing here, it's an occlusal photo that is showing that the premolar is quite rotated till the distal part, and by using two wires at the same time, and those wires are a 12 night tie thermoactivated wire, after 1 month I just achieved almost 90% of the derotation of those premolars. So here is the comparison of the first photo by using two wires and the second photo one month later, and you see that I just achieved a lot of rotation by using two round wires during this phase 1 on my therapy. So this is one of the big valuable things of using the double slot bracket in your alignment and leveling. And this is a scheme that I just brought you, and you see that on this image here I'm working with a single slot bracket in just one wire, and by using this you create 1 point on each side of the bracket, either on the tipping movement or the rotation movement, and you are creating 2 points or moments of rotation or moments of tipping of the tooth. But if you are using the double slot bracket along with two wires, two parallel wires, remember that, parallel wires, you are creating the double of moments of force and control of either rotation or tipping. So you are creating 2 moments here, one on the first on the first slot and the other one on the second slot on the each side of the bracket, and this gives you more control on this example of rotation of your tooth. So this brings you a little bit more control during the first stage of your treatment. The top number 2 of the use of the double slot bracket along with two wires is the dispensing of auxiliary accessories during biomechanics. We all know that if you are doing any biomechanics, you need to use Anchorage. You need to use either transpalatal arch, lingual arch, or even mini screws to avoid the undesirable movements of the teeth that you don't want to move. So the double slot bracket is just like an overlay or being dual arch, and we know that when you use the double arch or the dual arch or the overlay, the essence, the objective of by using these two wires is that we use a rectangular stainless steel wire to anchorage my teeth, and the second wire, which is going to be a round wire normally, and thermal and more flexible wire to move the tooth or the teeth that we want to move. So basically the dual arch has the objective to anchor and to move, and it's a simple way to do biomechanics, and this is being doing for a long time ago. We just came up with the idea of offering to the orthodontist 2 slots to turn a little bit more easy the use of those 2 wires during the therapy. So it's like the piggyback technique. So what you're seeing here, it's normally a 1622 stainless steel wire anchoring the teeth and a round 12 night tie wire getting the movement of my laterals on their best position. The problem here is that this colleague is using one single slot to use these 2 wires, and we know that when we use 2 wires inside the same slot, they generate a lot of friction, and due to the fact that the wire has to slide to the back, this is going to be a little bit more difficult, but it's not something that we cannot do. Actually, we can do, but it brings me a little bit of a problems. And also, normally, depending on the sizes of the wires that I'm going to use simultaneously in the same slot, they don't fit because they don't have large space. So by using the double slot bracket here on the middle, you have 2 slots open and rectangular, and you can diversity a lot of wires at the same time. See that we actually have something called double slot bracket that is a long time ago came up with the idea with the Damon bracket here and the Quick of Orthodontic. But those two brackets, there has a auxiliary slot which is closed and has a 16 per 16 of dimension. So it's very hard to insert a wire inside those two auxiliary and closed slots. That's why I just recommend the double slot bracket, because it's so much more easier in order that the two slots are open. So you can use that normally by tracting canines. What you're seeing here is just a 17 per 25 stainless steel wire with a bypass to anchor my teeth, and a second round wire to do my movement here of the canine that is quite impacted of the patient. Here I have a long time after my beginning of the therapy. You see that canine is quite on his right position, but one important thing that you see here is that this tooth here needs a little bit more of tipping to the distal part. So I use here a 16 per 22 thermal activated wire on the canine, and as well I just kept the 17 per 25 to keep anchor my teeth. It's something impossible to imagine in a single slot bracket. You're never going to use two rectangular wires inside a single slot bracket because they doesn't fit. So by using double slot bracket, you can use two rectangular wires to get more control movement and as well more control of anchorage. Here I have the same patient with the canine, the 2.3 on the other side that was a little bit misaligned, and I just align all the teeth before I just insert the 2.3 on the biomechanics. So here I have the canine a little bit rotated to the mesial part, and I didn't put on the beginning my canine because I know if I just try to align the canine along with the old teeth here, I will have a problem on my premolar and my lateral. So I just let out my canine, I start to align and level my teeth, and after I had everyone's aligned, I just use a piggyback technique or two dual arch at the same time. So here I'm having the anchorage by the 17 per 25 stainless steel wire, and I have the 16 round wire here to align my canine. So this is how we do this first stage of alignment and leveling by using double slot bracket. And here I have my canine in his right position without any problem, without any undesirable movement in my biomechanics. As well, the overlay and the dual arch is made by use this kind of biomechanic to track a lateral that is on the palatal area, to bring a canine that is up on the occlusal part. So here I'm doing the opening of the space of the lateral after I just move on the lateral on the front side of my patients, and here I am doing my leveling of the canine. And you see that I'm using here at the same time two different wires. I'm using a segmented wire that goes from the premolar to the molar on the right side, and from the lateral till the other molar to anchoring. And to not generate more deflection and more force on the canine, I just get here this thermal round wire that gets out from the central, pass through the canine and goes directly to the molar, and this gives me less friction and less force because I'm not deflecting so much the wire on the canine. Here the continuous of my therapy here by leveling the canine, and this is the last photo that I have this patient. This patient is still on progress, and I think on the next month the canine is going to be on his right position. Another thing that we can do, it's intrusion of molars. So what you're seeing here is a dual arch, one anchoring 17 per 25, and just a segment of wire that goes from the premolar to the molar and is getting the intrusion of this molar. Here is the first photo when I began the intrusion. Here is a few months later. Here I have another photo a few months later, and you see that from this photo, the beginning of the photo, to this one, I just variate the slots. I just put the 17 per 25 that was on the cervical area, I just put on this photo on the 22-inch slot, which being on the most occlusal part, and I pass the thermal activated wire to the gingival portion of the slot, and this generates more potentialize of intrusion by the deflection of the wire. At the end, this is the result that I have in about 5 months. So by doing this kind of mechanic, by using 2 wires along with 2 slots that is been able about this bracket, I didn't use anything rather than 2 wires, because I didn't have to use mini screws, I didn't have to use transpalatal arch, not either any other auxiliary accessory to do this kind of mechanic. So this is more simplest way to do biomechanics with a hard movement, which is the intrusion, as we know. We also can do uprighting of molars, that like you're seeing here. I'm anchoring the part of the premolar on the 2 sides, so I have a continuous arch wire stainless steel 17/25 through the 3.5 to the 4.5 on the lower arch, and another thermal activated wire that goes through the molars, and this is giving me the movement of uprighting. We also can do power arms like you're doing here. So what you're seeing here is just a power arm anchored on the second slot or on the 22-inch slot, and by doing this power arm I can uprighting this molar just as you're seeing. And here is the final photo after uprighting this molar, and here is the panoramics before and after the movement. So by using the double slot bracket along with 2 wires, just like the pickback technique, one to anchor and another to move, we can do a lot of biomechanics. The hardest biomechanics that we saw, intrusion, uprighting, to level teeth, to tract impacted canines without any auxiliary of Anchorage regarding the use of 2 wires. So you turn your biomechanics so much easier and more comfortable, not only for you but as well for your patient, which can also bring a more predictable movement by using this kind of bracket with 2 wires. The number 3 of my top 6 on my list is that either if you have to use mini screw, you as well, by using 2 wires, you can potentialize or either avoid some kinds of movements during your therapy. So let's imagine a closed space closure of 2 extraction of premolars. Here I am using a mini screw in order to retract all the 6 anterior teeth, and we all know that every time I do this kind of retraction, what happens is that I lose the torque of my anterior teeth. And in order to avoid this kind of thing, normally we used to use a high prescription to move forward the teeth, or even doing by a manual torque a opposite movement that occurs when we do this kind of retraction. But how can this bracket along with 2 wires helping me to avoid this kind of loss of torque? And it's simple. What you're seeing here is that on the 18-inch slot, which is on the more cervical or gingival slot, I'm using a 17/25 to slide my teeth back. And on the 22-inch slot, I'm using this accentuate curve of speed of wire in order to counterpoint or to opposite the movement of loss of torque. So what this wires is doing is generating a inclination towards to the front, instead the movement that is resulting of the loss of torque. So I'm opposing the movement by using this wire here, and this is how we can use the double slot bracket along 2 wires to avoid this kind of resultant during the retraction. So even if you are using a mini screw in your biomechanics, even so you can take advantage of the double slot bracket and 2 wires at the same time. The point number 4 of the top 6 that I want to show you is something that I really like. And the number 4 and the number 5, they are connected on each other. So it's regarding to a typical positioning and reducing of the torque effect. We know that every time we want to generate some kinds of vertical movement let's imagine on the open bites and we want to extrude some teeth, or even in the closed bite that we want to intrude some teeth. We normally, this is a characteristic of the orthodontist, they change the position of the single slot bracket, either more gingival or more incisal. And by doing that, you can generate this vertical movement towards to the extrusion or intrusion. But every time we change this positioning, we are interfering in the torque. So if you're using like this bracket here, more gingival or more incisal, what has happened is that you are going to interfere and you are going to change the torque that is generated by the bracket. So it's a very thing, it's something that we have to understand and we have to deal with. Normally, if we change the position of the bracket and we are interfering on the torque, we have to manage this torque either with a high or low torque, or even with a manual torque on the wire in order to counterpound this kind of movement. But why the double slot bracket? It's different because you can move the bracket forward or downward, doesn't matter, and either if you move up or down, you are going to still have one slot on the center of the crown. So if you are seeing here, the tooth here on the middle, it's quite well positioned. And on the right side, I have a bracket that is a little bit more gingival, and on the other hand, I have on the right side a bracket that is a little bit more incisal position. But if you see the both bracket on the both sides, you are going to see that even here or here, I have one slot that passed through the middle of the crown, and this reduces a lot the effect of the torque. So we're not interfering that much if we are using double slot bracket comparing to a single slot bracket. That's why I really love this kind of management of torque without getting a lot of interference on the torque by positioning more gingival or more incisal the bracket, double slot bracket here. And on the same way of the positioning of the bracket, something that I really love on the double slot bracket is that we can vary the slots from one tooth or one teeth to another, and by doing this kind of variation we can do vertical movements of a tooth or a teeth. So imagine this kind of situation that you have to close the bite on the side of the patient, and to do that with a single slot bracket, normally we have to use a intermaxillary elastics and everything, but by using the double slot bracket here, what you're seeing is that the wire is getting out from the canine here on the most occlusal or incisal slot, and when it's entering on the premolar, he's passing through the gingival slot. And by doing this kind of variation from one slot to another, we create a little bit of deflection, and by doing this deflection, I force the tooth to go up, or being extruding the tooth without any use of any other accessories. So this gives you more control and more successful movement because I didn't depend my patient to use the intermaxillary elastics. And just like the case that I just showed you before, by leveling this canine, you are going to see on here part of the photo, on the side photo, that the wire is getting out from the central here, that 1.1, and when enter on the canine, he's going to the most incisal slot and not on the occlusal slot. And why is that? To not generate more deflection. So I'm using the first slot here, or the most incisal slot, and once the canine level a little bit, then I can change to the most occlusal, the most gingival slot. And once I move to the most gingival slot, I generate a little bit more deflection and a little bit more extruding. And by using this kind of variation of the slot, I can reduce the force and I can work with a more biological force during my leveling of the canine. So this is something I really love by using double slot bracket. This variation of the slots from one to another can bring me almost 1.5 millimeters of vertical movement, which means that from one slot to another, I can extrude or intrude almost 1.5 millimeters. And I can do some 2 or 3 variation that gives me at the end of the bottom of the line 3 to 4.5 millimeters of extruding or intrusion without getting the interference of the torque. So you imagine an open bite that has normally 5 millimeters or 4 millimeters or 3 millimeters. Just by doing this kind of variation of slots from one teeth to another, I can close all the bites, or I can open a closed bite just by doing this variation without changing the position and without interfering the torque on my patient. So this is a very huge thing that I really love on the double slot bracket. And the last but not the least, and not the less important, is my top 6 on the double slot bracket, that you can selecting the slot for your case finishing. So if you love to work and finishing your cases with an 18-inch slot, you can work the most gingival slot to finalize or finishing your case. But if you are a fan of the 22-inch slot and you want to finish your case by using the 22-inch slot, you just have to use the most incisor or occlusal slot to finish your cases. So you can, depending on your case or depending on the slot that you love, you can finish your cases by selecting one or the another, because you have the 2 slot at your disposal. So summarizing, guys, I can work with any slot that I want or need during my biomechanic, 18 or 22. I can use a bidimensional bracket by using just one bracket, and this is a very important thing. I can actually work with segmented or continuous wire and in the 2 slots independent of each other, so you can use that as you want or need. I can use the 2 wires at the same time in different slots, which is very important. It's something that I really use in all biomechanics that I'm working with. If you are going to compare the use of 2 wires inside one slot or the 2 wires inside or 2 slots, you have less friction on the double slot bracket regarding to the same case on a single slot bracket. Basically, you can vary the slots, as I told you right now, to achieve vertical movements during your malocclusions, depending on which ones you want to use, intrusion or extrusion, deep bites or open bites. You can reduce or avoid extra accessories of Anchorage during your biomechanics. So normally in 80% of my biomechanics, I don't use transpalatal arch, I don't use lingual arch, I don't use mini screws, because I can replace those kind of accessories to a rectangular stainless steel arch wire that will give me the sufficient anchorage to do that. Okay, the mechanics become more simplified and more comfortable, and we can work with a diversity of wires. So I really thank Dr. Akram for this invitation. I'm really pleasure, and I'm really enjoyed to be here today and showed you a little bit of my work and the double slot work with 2 wires to simplify and to get you a new concept of biomechanics. Those are my contacts, and I really thank you all for being here, and God may bless you. I'm here, and have a good day. Bye bye.